Yeah.
Did you all get any baseline concussion testing in high school or no?
No.
You know, where they
I
do
didn't.
like a neurological exam?
I think college was the first time they did something like that.
At JMU?
Yeah.
Yeah.
But NFL, it's huge.
Yeah.
Like that's the
Now
first thing you do. Yeah. That's
Right.
the first thing you do.
Right.
If you're there for a physical, we're going to
get
go.
that concussion
You're like,
test.
oh man, like every year you're like, man, I got to do this again.
Yeah.
But it's good. It's you see it. It's helping.
Right. Why is that important? From your perspective, like doing the baseline testing?
I mean, it's interesting because I think the pendulum on preseason testing has swung a little bit. You know, there was a time period where there was a big push that everybody should get pretty complicated preseason testing that involves computers and, you know, all these different type of devices. And I think what we're learning now is it is important to have some preseason information, just like you would get a cardiac, physical, like the doctor would listen to your heart or he'd check your bones and joints. There should be some assessment of the neurological system. But I think what we're learning is that certainly for the youth levels, it doesn't have to be as sophisticated with all the bells and whistles that you'd have at the higher levels. And in fact, you don't want it to be quite so complicated, because what ends up happening is, we talk a lot during coronavirus about disparities, but there's a big disparity between, the private school that can afford like a computer lab and a bunch of expensive equipment, and, the inner city school that doesn't have that kind of resources. Probably the greatest equalizer first is to have an athletic trainer. You got a contact sport on campus, you should have an athletic trainer.
Yes.
And in those trainers, we all learn, we call it the SCAT, the Sport Concussion Assessment Tool, is kind of a brief clinical exam. Like if you would see the doctor, he would check your symptoms and he'd, check your reaction time and your memory and a few things like that, check your balance. And they can do a lot of that stuff without a computer if you had a trainer. And most trainers know these kind of things. And so, I hope as we go forward, particularly for youth sports, that we see a little more of that.
So you find that that there is a lack of athletic trainers servicing high schools in lower socioeconomic demographics?
Yes. Absolutely. I mean, here in Los Angeles, a couple years ago, we were inquiring in the public school system, and there were between 80 and 90 public schools that had tackle football as a sport. And there were only 5 or 6 schools that actually had trainers at that level. Now, private schools sometimes, might even look like the league.
Yeah,
they have multiple trainers for different sports and stuff.
I'm sure there's high school football in Texas. I'm sure. You see those stadiums out there.
Yeah, some of them have a lot of resources, but where most kids are playing, it's not like that. It's not with really deep pockets, and it's important then to make sure that we have to prioritize what we think is, what do we think is important as a society? Well, I think sports are important as a society for our kids, sure. But we have to give the schools the budget that they can afford to have an athletic trainer. It should be like having a school nurse. Yeah. That should be important. Some of these big schools, you definitely need that kind of personnel.
Did you have sort of readily accessible athletic trainers to you in high school?
We would have a guy pop up that was at Temple. He would come and tape ankles and be there. And of course we had medical at the end of the field. But no, I mean, you just kind of just play and
sure.
go home afterwards.
Yeah.
Right.
There was no one really there to, if something happened, well, we'll check it out afterwards.
Hey, if you enjoyed that clip, check out the full episode on our YouTube channel. Don't forget to subscribe. Don't forget to follow us on social media. And most importantly, stay safe and be well. Thanks.